I always encourage women to do a self-breast examination, and the ideal time to do a self-breast examination, you can do it after your period, which is once a month, so it's regular, because you know, with our bodies as well, our breasts change in consistency throughout our you know, a fertility cycle.
Yes.
So when the breast is nice and soft, it's just after your period, and that's the ideal time when you can feel lumps and bumps. And make it a routine where you stand in front of the mirror naked, you look at yourself, you know, you look at your breasts, look at what we call symmetry, meaning are they the same, on the same sort of level? Obviously all of us, our breasts are not at the same level, but you get to know yourself because everybody has their own normal. You look at your breasts, are they on the same level, or is one now starting to slightly rise up than the other? You know, you also look at the skin. Are there changes on maybe on one aspect of my breast? You know, orange peel skin, you know, an orange, it's got those little marks. We call it peau d'orange. When you've got breast cancer and there's a lump just under the breast, it starts looking like that little orange look. You look at that. Your nipple, are the nipples still out, or are the nipple starting to go in? Normally
and
the side with,
like inverted.
The side with the breast cancer, the nipple sometimes starts pulling in. Or you see as if your skin is like puckered, you know, as well. And then obviously you see the lump. Any changes in the color as well. Is there a little bit of redness or a little bit of darkness? When I squeeze my nipple, does my discharge come out of my nipple, or even blood come out of my nipple? Also, treat your breast like a clock. You know, start at 12 o'clock.
Go all the
3
way.
3 o'clock, 6, 9 o'clock, and then the opposite breast. And also feel under your armpits as well. And then do it as well when you are lying down. And you must go deeply into, not just superficially on the surface, move into your breast. You know, because you know, your breast is like a little round object, and it's got a tail, what we call an axillary tail. You know, so it's round, and then there's a little bit of tail. So a lump can be anywhere, and even underneath your nipple as well. By the way, don't, you know, you feel, you move. We call it palpation. You move, you move, you knead, you go in, you go right up into the armpit.